If you have type 2 diabetes, don't you think it would make more sense to treat the root cause of the disease rather than trying to fix the damage to your body after it's already happened? Hi, I'm Dr. Maria Conley, and today I'd like to talk to you about how type 2 diabetes happens and the best way to treat it. Type 2 diabetes is a dietary disease. Therefore, the best treatment is a healthy diet. The root cause of type 2 diabetes is too much sugar or carbohydrates. So, what is the most logical way to treat type 2 diabetes? You can treat your type 2 diabetes by reducing your carbohydrate intake, lowering the amount of processed food with added sugar that you consume, and by not drinking your calories. This means avoiding beverages that are sweetened with sugar. It makes a lot more sense to attack the root cause of type 2 diabetes, which is high carbohydrate intake, rather than trying to fix the damage that diabetes causes after it has already occurred. That's why the first and best treatment for diabetes is a low carbohydrate diet. If you can control your diabetes with diet, you may not need to start a medication. That would be the best outcome. So, how do you treat your insulin resistance and type 2 diabetes with diet? The answer is a low carbohydrate diet at a minimum. A low carb diet means that you are consuming less than 30% of your daily calories from carbohydrates. This translates into a daily carbohydrate intake of less than 130 grams. I would recommend a low carbohydrate diet for most people with prediabetes or diabetes. Dietary treatments that require a little more work include a very low carbohydrate diet or a ketogenic diet, which typically involves consuming less than 10% of your total daily calories from carbohydrates, which translates into less than 20 to 50 grams of carbohydrates a day. Another more intensive option would be intermittent fasting, which allows your pancreas time to take a rest from insulin production between meals. So, how does type 2 diabetes develop? Type 2 diabetes is a disease characterized by high toxic levels of glucose, which is a type of sugar in the blood. Your pancreas is no longer able to produce enough of the hormone insulin, which normally drives glucose out of the blood and pushes it into the cells to be used as fuel. So, how is excess carbohydrate intake linked to the development of diabetes? Well, over time, if you consume more carbohydrates than your body can use as fuel, these carbohydrates are stored as fat in the liver. Specifically, the carbohydrates that you eat include different simple sugars and starches, which are all broken down by your digestive system into a simple sugar called glucose. Your liver converts this excess glucose into fat, which is really the most convenient way for your body to store it. This process is called denovo lipogenesis. Much of this newly created fat is stored in the liver, causing fatty liver disease, and also in the pancreas, causing fatty pancreas disease. This is the twin cycle hypothesis of type 2 diabetes, which was first described by Roy Taylor in 2008. Basically, excess carbohydrate intake results in fatty liver, which then leads to fatty pancreas, which then finally results in type 2 diabetes. Over time, the liver keeps processing this excess glucose and storing it as fat. At this point, the liver becomes resistant to the hormone insulin, which is trying to push more of the glucose into the liver cells, which are already full of fat. So now you've developed fatty liver disease. This is often a warning sign that type 2 diabetes may develop in the next 10 years or so. Once the fat capacity of the liver is exceeded, it will start exporting newly created fat to other organs in the body. A healthy liver will make new glucose while you're fasting overnight, while your blood glucose levels are low. This process is called hepatic gluconeogenesis. Another job of insulin is to turn this process off when your blood glucose levels are already high, like after you eat a meal. But all this excess glucose has made your liver become resistant to insulin. So the insulin coming out of your pancreas will no longer be able to push more glucose into the liver. So insulin will also be unable to stop your liver from making new glucose, even as the glucose from the food you have eaten starts to build up in the blood with nowhere to go. In response, the pancreas will just pump out more dysfunctional insulin. As you might imagine, this sets up a vicious cycle of high blood glucose levels and increasing production of dysfunctional insulin. What does your liver do with all this excess glucose that it can't process? As we discussed, it starts to turn this excess glucose into fat in a process called denovo lipogenesis. After the liver cannot store any more fat, it begins to export these newly created fat cells to the rest of the body, packed inside small particles called VLDL, or very low density lipoproteins. These new fat cells are deposited in different organs, including the pancreas. That's a problem, because the beta cells of the pancreas should be producing insulin. As more fat is deposited around these beta cells, they gradually become more dysfunctional, and over time they stop producing insulin. We don't know exactly how the excess fat in the pancreas kills off these previously healthy beta cells. It could be that the fat cells are directly toxic to the pancreas, causing the beta cells to undergo programmed cell death, or apoptosis. Once you have lost about 50% of your pancreatic beta cells, your pancreas is no longer able to produce enough insulin to drive all that glucose back into your cells. So you have chronically elevated blood glucose levels. Now you have developed type 2 diabetes. It's not healthy for your body to store fat in the liver, pancreas, muscle, or other organs. Fat doesn't belong in these places. Fat cells that are stored in and around organs are more likely to cause inflammation and insulin resistance. Where your fat is stored is very important. Fat stored in the right place, which would be subcutaneous fat, which is fat stored right underneath your skin, is what we call healthy fat. This type of fat doesn't tend to cause inflammation or insulin resistance. However, fat that is stored in the wrong places, which would be inside and around your organs, is what we call unhealthy fat. If all your fat is stored in unhealthy places, like inside and around your organs, it is possible that you could develop diabetes even if your total body weight is normal. Your body's tendency to store unhealthy fat is partially determined by genetics. For example, individuals from South Asia tend to store more fat in their organs, which means that they're more likely to develop type 2 diabetes at a lower overall body weight. In the next video, we'll discuss how to stop these reinforcing cycles of fatty liver and fatty pancreas. By intervening in these destructive processes before it's too late, you can potentially reverse your diabetes, especially if you start early in the process. Thank you for listening. I hope that this has been helpful for you.